So let's bring our good friend Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, with us this morning. Good morning, Joe.
Hey, Ray. How are you?
I'm doing well, my friend. Glad you're on board with us today. You're going to look at what? Trainers and that type of thing?
Yeah, I mean, isn't it a little bit of a head-scratcher on what people, I think, are talking about maybe the most in the sports medicine realm nationally is, what is the role, what's happening in New England with Tom Brady having a personal trainer and his personal trainer kind of treating New England Patriot players and high-profile Boston athletes for a decade, and now he's no longer allowed on the sidelines, causing a rift with the coach and the medical team. So I always kind of try to get the message across, Ray, of so many things that we learn lessons about, we learn in our days of sport. The sports medicine team is exactly the same way. It's a team, and everybody has their own role, and this seems to be an example of where the roles get a little bit confused, or people kind of overlap the roles or go too far within their role. And so this is kind of trying to understand what somebody like Alex Guerrero is. So in the bigger scope of things, Tom Brady's done an incredible job at 40, staying healthy, talking about playing into his mid-40s, by way of keeping his body healthy. And they've he and his personal trainer have put together a method for staying healthy called TB12 and all this, and Alex Guerrero oversees that. And Alex Guerrero, who's worked with him for over a decade, is what's known as a personal trainer or a strength trainer versus what is an athletic trainer. And so those are different people on the medical team. And so is a physical therapist, a sports physical therapist. So what a strength trainer or a performance enhancement coach or a lifestyle coach, what those people are is they're supposed to take the well athlete and make them better athlete, improve their performance, prevent injury, keep them healthy over a long period of time. And that's kind of what those people do. When somebody is injured, though, that's when an evaluation by a certified athletic trainer, perhaps by a sports medicine doctor or a sports medicine orthopedist or surgeon, and maybe the care of a physical therapist to rehabilitate them from an ACL tear or a ankle sprain or a knee injury of any other type. And so in this situation, it appears that the personal trainer started moving over into the area of treating some of the injuries, and there was a lot of confusion on the Patriots. Do we go with our coach? Do we go with our, Hall of Fame quarterback? Would we make him mad if we go away from his personal trainer? And so this is an issue, Ray, that is faced by parents in Akron, Ohio. Yes, in Akron, Ohio, every day of the week. There's over 20 to 25 personal trainers in this area that work young athletes. And so I wanted to try to clear up some of the issues as parents face those things about seeking out a personal trainer.
Joe, personal trainers, is there a big difference between one that can go with the adult, mature athlete compared to a teenage athlete, or
I
are
think
they
there
all
is,
together?
and that's a really good question. And thanks for bringing that up. You know that we've staked a career being here at Akron Children's, and that there's a difference in young athletes. And the biggest difference is young athletes still growing. Their bodies haven't fully matured. They have areas in the body that are more kind of weak spots called growth plates, and that you have to be concerned about when you're working them from the standpoint of not only strength training, but also from the standpoint of aerobic training. There's differences. And so, yes, that is something, and there are people that are specialized in working with younger athletes. But I think it's very fair for parents to ask, what is the training of the person who is purporting to be a strength coach or a lifestyle coach or a personal trainer? where did they get their training, what is their specialty, what are they going to do with my young athlete. This is an area where a lot of the criticism side of it is, Ray, that a lot of these people charge a lot of money to the young athlete to do this. Sometimes they talk about a lot of equipment, or they talk about a lot of supplements that they ask the young athletes to take, and some of those are seen as kind of money-making issues, versus there's other people in our town that do a great job training athletes, particularly in my world, young athletes, that I trust very much in caring for these young athletes and improving their performance and getting them into the prevention mode to prevent injuries.
Good stuff, Joe. Thank you for joining us. Great insight there, personal trainers and more. Joe, thank you. We'll catch up with you next week.
See you next week, Ray. Thanks.
All right. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live.